Hello, you're watching The Wire. Today is March 27th, and this is the daily COVID-19 updates bulletin. As of Friday morning, 724 people with COVID-19 were reported by the Ministry of Health and Family Welfare. Of this, 640 currently have the infection, and the rest are people who have recovered, been discharged, or have died. The US now has the maximum number of people infected with the new coronavirus infection. 16,000 more people tested positive for the first time on Thursday alone. Over 85,000 people in the United States now have COVID-19, followed by over 81,000 in China and around 80,000 in Italy. At least 1,290 people have died in America so far. India's central bank governor Shaktikanta Das, among other things, announced big packages for India's middle class today. He said that all banking institutions can offer moratorium on all loans for a period of 3 months, which means the loan period will now have 3 additional months attached to it. For the immediate period of 3 months, people will not have to pay their EMIs inclusive of their principal amount and interest. This, if their respective lending institutions other than PSUs implement this. At 2 municipal corporation hospitals in the Kalyan area in Dombivli, only 50 kilometers away from India's financial capital, doctors were seen wearing flimsy green-colored cloth cotton masks, no gloves, by The Wire's reporter Sukanya Shanta. There are no gloves or any protective gear available in 2 municipal hospitals, Shastri Nagar Hospital and Rukmani Bai Hospital in that area. Kalyan and Dombivli have reported 6 positive cases of COVID-19 so far. Of these, at least 4 people had walked into the hospitals in the last 2 weeks before being referred to Mumbai's Kasturba Hospital. We are all going to be infected. A few of us might even die. We are only waiting for our turns, the doctor told The Wire as he prepared to handle another 20 patients lined outside the hospital. The chief medical officer asked the doctors in the hospital to wash and reuse the gloves, and the doctors have been doing so as advised with no other option in sight. You can read more about this story by clicking on the link in the description below. The Union Health Ministry has restricted the sale and distribution of hydroxychloroquine, stating it as an essential drug to meet the requirements of any emergency arising due to the COVID-19 pandemic. The order issued on Thursday said that in public interest it is necessary to regulate and restrict the sale and distribution of the drug. ICMR has issued guidelines to use hydroxychloroquine as a preventive medication for healthcare workers attending to COVID-19 patients. The center has pulled up all state governments for not monitoring Indian citizens who have returned from abroad in the past 2 months, stating that this could seriously jeopardize efforts to combat the spread of the coronavirus. In a letter to state chief secretaries dated March 26, Union Cabinet Secretary said that there was a considerable gap between the numbers of international passengers who returned and those who were being monitored. On the 18th of January, India began screening international incoming passengers at international airports. But state governments may not have been monitoring all targeted Indian returnees as required, the letter said. British Prime Minister Boris Johnson has tested positive for coronavirus and is self-isolating, but will still lead the government's response to the outbreak, he said in a tweet. A Downing Street spokesman said that Johnson was experiencing mild symptoms on Thursday and has been tested positive for coronavirus. A first-of-its-kind virtual G20 summit was convened on Thursday to address the social and economic impact of COVID-19 across the world. The summit was chaired by Saudi Arabia. In a statement issued by the Indian Foreign Ministry, G20 countries committed to inject over $5 trillion into the global economy to counter the impact of COVID-19. Today's COVID-19 fact is about bats. What is it about bats that makes them the carrier of most viruses? It is not the first time that the world has witnessed an outbreak of a bat-borne virus. Ebola is thought to have originated in bats too. Bats are the second most common mammal after rodents. There are more than 1,300 species of bats, and some can even live up to 40 years. Experts believe that it's bats' unique immune system that allows it to harbor so many viruses. Bats have higher levels of proteins that signal the presence of viruses in the blood. Bats are also the only mammal that can fly, which increases their body temperature and puts their bodies in a constant state of fever. As a result, bat populations become virus reservoirs. Some of these viruses mutate over time and jump to other animals, even humans. That's all for today. I will see you tomorrow. Until then, stay safe. Thank you for watching.